Schizophrenia, what is it? In today's video, that's what I will explore. I will explore schizophrenia in detail. Welcome to my channel. I'm Dr. B. I'm a board certified and fellowship trained physician, and I've been caring for patients for over 20 years. I make educational videos on medical topics to educate others and myself. If you enjoy them, please hit subscribe. To illustrate what schizophrenia is, let's start with a true story. A 19-year-old man had chronic shoulder, elbow, and wrist pain, and he saw 3 different physicians, had 10 separate sports medicine appointments. He carried the diagnosis of multiple strains, sprains, tendon and nerve injuries, and finally was referred to a physical therapist. In his PT appointment, he got to know his therapist well, began visiting with the therapist, and the patient finally confided that he actually really understood why he was having all these trouble with his joints. The patient confided his knee and wrist were hurting and cold because of electromagnetic impulses sent to his joints via an electrical implant. Now, this had been implanted into his body 2 years earlier by a government organization, either the CIA, the US government, or the US Army, and that this device was the cause of his ongoing multi-level joint pain. In addition, the impulses generated by the implant controlled his actions. They caused his falls, his injuries, and caused his joints to become cold and painful, especially when he was doing things that these government agencies did not want him to do. And this included breakdancing, snowboarding, skateboarding, or exercising. Furthermore, he often received commands from the electrical implant telling him to harm his friends and his family. This is a classic delusion and is a characteristic symptom of schizophrenia. But schizophrenia is actually a syndrome, meaning there are multiple symptoms that are associated with it, and different patients may experience different symptoms and still be schizophrenic. The symptoms can be broadly categorized into 3 major areas: positive symptoms, negative symptoms, and cognitive symptoms. Now, in schizophrenia, the words positive and negative used to describe the symptoms are misleading because both types of symptoms are really bad to have. In schizophrenia, patients have positive symptoms, but they aren't positive in the sense that they're helpful. They're positive in the sense that this is a behavior present that shouldn't be, and other non-schizophrenic patients don't have that symptom, even a little bit or even less severely. Positive symptoms are also known as psychotic symptoms, and this is because they demonstrate the characteristic inability to recognize what is real and what isn't real in the world. The positive symptoms include number 1, delusions, number 2, hallucinations, and number 3, grossly disorganized speech and behavior. Now, number 1, delusions are a very firm fixed belief in something that is not plausible, and a schizophrenic has an unshakable belief despite any amount of explanation, logic, or science. The patient described above has a classic delusion: body implants from the CIA controlling his actions and thoughts. Implausible, and yet his belief was cemented as an absolute truth that could not be altered. This unwavering belief is characteristic of a schizophrenic delusion. Number 2, hallucinations. Hallucinations are seeing, feeling, or smelling imaginary things. Now, the medical terms for these are visual hallucinations, tactile, or auditory hallucinations. So someone with schizophrenia may see people, see things or places that don't exist, and they will feel things, bugs and insects crawling on them or in them, around them, that don't exist, and they will hear voices threatening and commanding that others don't hear, and they do not have the ability to recognize that none of these hallucinations are real. Number 3 is disorganized speech and thinking. In a conversation with a schizophrenic, you will hear what's known as word salad. This is a random mixture of seemingly random words and phrases. Many words, but they don't fit together or they don't belong in the sentence, and often they're not even real words, but are actually made up words. The conversation is completely incoherent. The talk will have no straight line logic or linear pattern, but will be up and down and all over the place. Now, after the positive symptoms are the negative symptoms, which are also bad. Negative means that there is a lack of a behavior that you would expect most people to exhibit. The first of these is known as avolition. This means lack of motivation and inability to have goal-directed behavior. Now, this isn't just for a career or school, but even for abnormal activities of daily living. Someone with schizophrenia may sit all day long and do literally nothing. As an example, they have an inability to start or complete paying bills, even if they're urgent. They may not be able to perform basic personal hygiene, such as washing themselves, changing their clothes, getting a haircut, doing their teeth, and they're unable to care for children or pets. The second negative symptom is known as flat affect. Schizophrenics will often have no emotional response in situations that should have an extreme emotional response. They exhibit a complete lack of facial expression, eye contact, hand gestures, and they have no variation in their voice pattern, instead speaking in a monotone. Someone with a flat affect has an extremely limited range of expressions, even in situations that would normally seem very exciting or very sad. The sudden death of a loved one or the birth of a new grandbaby will be met with no more reaction than getting a drink of water or reading the newspaper. Upon hearing the news, someone with schizophrenia in the setting of a tragedy or a great joy will not smile, will not cry, laugh, have any joy or sadness in their response. The Diagnostic and Statistical Manual, 5th edition, requires 2 or more of the above symptoms. These can be 1 positive and 1 negative, or 2 positive symptoms. These can be used to meet the criteria for schizophrenia. Cognitive symptoms, meaning mainly difficulties in thinking, although often present, are not required for the diagnosis. For example, the famous mathematician John Nash Jr., who was immortalized in the movie A Beautiful Mind, retained remarkable cognitive function, but was clearly schizophrenic. Now, to meet the criteria for schizophrenia, the 2 symptoms must be present for at least 30 days, and similar to the diagnosis of most disorders in the DSM-5, they must significantly affect basic functions, including one's work, interpersonal relations, or self-care. Usually someone with schizophrenia struggles to hold or maintain a job, and schizophrenia is a very common diagnosis for those that are homeless. Now, other things can cause psychotic symptoms. The characteristic inability to recognize reality seen in schizophrenia. This is known as psychosis, but is also commonly seen in other entities such as substance abuse, especially things like LSD, acid, extreme sleep deprivation, and a number of other mental disorders, including those individuals who are severely depressed, those who are bipolar and experiencing a manic phase, and some individuals suffering from severe borderline personality disorder can also have psychotic episodes. All of these reasons for psychosis need to be excluded before schizophrenia can be considered. Those are the criteria for schizophrenia. Thanks for watching. And remember, this video is only for education purposes, not to make a diagnosis. Make sure you seek a qualified health professional if you or a loved one needs evaluated. And if you're interested in more educational videos, try this one on agoraphobia or this one on social anxiety disorder. And please don't forget to hit subscribe.